Please direct all questions to co-chairs and grant staff. Today's anticipated meeting schedule is shown here. Please note that all times are estimates. And Avery, before you take the roll, I would like to invite co-chair Casey Beck to introduce herself.
Thanks, Will. I am attending this meeting in a new role today as the very recently designated Impacts co-chair on behalf of the Oregon Criminal Justice Commission. And I am excited and honored to be able to serve on this committee in this capacity. And quite frankly, I just really look forward to all the work that we accomplish together over the next 6.5 months. But I'll hand it back over to you, Will.
Thank you so much. Avery, would you be willing to take the roll, please?
Absolutely. Co-chair Sam Byers.
Good morning, present.
Co-chair Casey Beck.
I'm here.
Judge Shanti. Jeremiah Stromberg.
Good morning.
Liz Weber.
Good morning, present.
Steve Gunnels.
I'm present.
Eric Swallow. Chief Marsha Harnden.
Present. Good morning.
Commissioner Claire Hall. Alicia Beamer.
Present.
Stacy Brubaker.
Present. Good morning, everyone.
Sheriff Nick Hunter.
Good morning and present.
Dr. Stanfill let me know that she would not be able to attend. Senator Gelser Bluen. Janie Gullickson.
Here. Good morning.
RJ Navarro.
Here.
Michelle Mason. Representative Choatson.
Present. Good morning, everybody.
Paul Solomon let me know that he would not be able to attend. And then Carl McPherson. Okay, I'll pass it back to you, Will. It looks like we do have quorum.
Thank you so much, Avery. We will now pause for public comment. Avery, has anyone signed up in advance of this meeting to provide public comment?
Nope.
Okay, so we will wait just a couple of minutes to provide that opportunity before we proceed. If you do have public comment, please use the raise hand feature to be called on before speaking, and please limit your comments to no more than 2 minutes. As a reminder, staff and the GRC members are not able to answer questions during this allotted time, but you are welcome to reach out to staff separately. So I will keep time, and so let us intentionally pause at this time for any public comment. Okay, thank you for pausing to allow the public to comment. And so we will now move into our action item for this meeting, which is the 2527 tribal set-aside decision. We will review a summary of the CJC's efforts to solicit input from the tribes with a consultation summary, as well as review the available funding for this biennium. Further, we will review previous impacts GRC action and our staff recommendation, and then take action. So the CJC sent a Dear Tribal Leader letter on November 21st, 2025, as a result of the identified critical event of new impacts funding and the development of a new solicitation. We also extended this invitation to existing impacts tribal grantees via email. We specifically requested input on the following 3 proposals that you see numbered on the slide in the Dear Tribal Leader letter. So relating to the funding set aside, staff recommend that at a minimum, the Impacts Grant Review Committee set aside 10% of available funding for tribes. This set aside amount matches that of each previous impact solicitation. Relating to the application timeline, in an effort to minimize potential gaps in funding for existing grant recipients and to allocate available state of Oregon grant monies in a timely manner, the solicitation process for Oregon counties will be condensed. This condensed application timeline and overlap in project periods will essentially eliminate any gaps in funding for awardees. Because the existing project period ends on December 31st of this year, previous impacts grantees, including 5 federally recognized tribal governments, will be without funds for the first quarter of 2026. All recipients of 25-27 impacts awards, however, will be welcome to apply funds to approved expenditures for any part of the project period, backdating expenses to as early as July 1st, 2025 through as late as August 31st, 2027. And then relating to the competitive application, as part of the 25-27 competitive application, any applicant who was a past impacts grant recipient may be evaluated on data previously reported into the statewide database, or REDCap. No feedback was received from tribes on these matters as part of this effort, and yet previous tribal input helped inform some of the following proposals that we intend to move forward with. Through consultation during past grant cycles, the CJC has learned that a 10% tribal-specific set-aside of funds was appreciated, as well as this GRC's method of reviewing tribal applications first. Further, the proposed condensed timeline that minimizes funding gaps is in the best interest of all existing grantees who may choose to reapply, including tribal governments. For these reasons, the CJC will move forward with the proposals, and that then brings us to the breakdown of available funding, which we will get to on the next slide. So considering the monies allocated by the legislature in the previous session, as well as carryover funding for the previous biennium, the Impacts Grant Program has $11,118,000 in the proverbial bank account. In the next several slides, we will walk through how do we get to the funding amount available to applicants, which will be slightly lower than this total funding amount. Statutorily, 3% of funding in this account must be allocated to research and evaluation purposes. And this 3% is $333,540. So with 3% of funds set aside for evaluation per statute, the remaining total funding available to applicants is $10,784,460, which you see reflected on this slide. The next step then is to determine an amount of funding that will be set aside for use by tribal government applicants. Per statute, at least one grant award must be made to a federally recognized tribal government. So consider a set aside as the minimum amount of funds available to tribal government applicants first. The total request from an award to tribal governments may exceed this amount, and that's okay. The remaining portion of funds is available to all applicants, including county and tribal governments. Staff recommendation is to continue this GRC's previous practice of setting aside 10% of available funding for tribal governments, which you see reflected here in bold on the left side of the slide. %10 of the available funding for tribal government applicants equals $1,078,416, as shown again on the left side of the slide. And that would leave $9,706,014 for other applicants, as reflected on the right side of the slide. And as a reminder, here's the voice voting process. Staff will articulate the matter that is up for vote. There is no need for motions. Those who choose to abstain from a particular vote will announce their abstentions before the ayes are taken. Those in favor will say aye or yes when prompted. Those opposed will say nay or no when prompted. So the decision before you now is whether you approve the staff recommendation.
Hey, Will,
Yes.
one moment. I see Jeremiah's hand up, and then I think we might want to pause for some discussion.
Of
Thank
course.
you.
Yes, Jeremiah.
Yeah, thank you. Good morning. My only question, I'm trying to recall and scrambling through past notes. The amount allocated for tribes, historically, has that full amount been requested and utilized? Has it been not enough compared to what's been requested, or has a portion of that actually gone back into the competitive process for both tribes and counties to compete for?
I'm happy to answer that question, Will.
Jeremiah.
Thanks, Jeremiah. Yeah, so gosh, it's been 5 years of this business, so understandably, some historical context would be helpful. And I can confirm that in the very first impacts iteration, 10% was set aside, and the actual request from tribal governments exceeded that amount ever so slightly. And this grant review committee chose to award full requested funds to those tribal governments. And if I recall, it was very minimal. I think it was maybe like a 1.5% extra, so maybe 11.5% total of available funding. And then in 2022, we again set aside 10% of available applicant funding for the use of tribes. And I believe that that one was not quite met due to the fact of carryover funding being available to those tribal applicants. And so some of that did get rolled over into the unallocated funding. But I would say, it probably averages out around fully utilized each time. And I think that the 10%, especially for this round with 5 established programs that may choose to reapply, I think 10% will be requested.
Great, thank you, Casey. That's helpful.
Are there any additional questions or discussion from the GRC before we proceed? No? Okay. Well, then, if there is no additional discussion, then the decision before you now is whether you approve the staff recommendation to set aside 10% of available funding to applicants, or $1,078,416 for use by tribal governments, as displayed here on the slide. Are there any abstentions? All those in favor, please say aye.
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 Thank you. All those who oppose, please say nay. So then the staff recommended tribal set aside amount has been approved. Thank you very much. And again, thank you for that decision. We will now move into a discussion of the 2025-2027 impact solicitation. which will begin with just a reminder of that available funding on the next slide before we proceed into an overview of the solicitation, including the project period. Beyond that, we will spend a good bit of time discussing the grant program operating profile that staff have constructed for the Impacts program and how we will deploy this tool as part of the solicitation to lighten the lift for applicants, for CJC staff, as well as this GRC when we meet again in February for funding decisions. Finally, we will talk about some data elements that staff plan to include alongside the grant program operating profile for returning applicants and the solicitation timeline. As a reminder, this is the breakdown of available funding for tribal government applicants on the left side of the slide. And on the right side of the slide, we see the amount available for other applicants. When this GRC last met in August, staff provided several considerations for the upcoming solicitation, for which this GRC provided input. Thank you again for the valuable input. What we heard from this GRC was a desire to apply scrutiny to applications received, to learn operational details of programs, including outcome measures, and an interest in a way to examine how programs adhere to their goals over the next biennium. Our team went to work on that, and we are excited to share more about the 25-27 impact solicitation today. The application components include administrative and eligibility questions, acknowledgements and required collaboration, such as medical assistance screening agreements, compliance with data collection and reporting, requirements, a tribal notification process and consultation report, required uploads for letters of support from community leaders or organizations, and acknowledgement of government approval if applicable. As well, the grant program operating profile, which I am excited to share more about in the coming slides, is the bulk of the application. As well, there's a budget projection and sustainability, which includes questions about existing funding sources and plans for sustaining impacts programming, as well as the required upload of the applicant's budget projection sheet. I also wanted to take a moment to orient you to the 25-27 project period, which extends from July 1st of this year, 2025, through August 31st of 2027. This will align with other CJC grant programs, as well as minimize funding gaps for existing grantees who may choose to reapply, as the ability to backdate approved grant expenses exists to July 1st, 2025. This will also allow for 2 months of overlap beyond the end of the 25-27 biennium to allow for grant closeout. So before we proceed into the details of the items in the application, let us first orient ourselves to time, which can always be challenging this time of year when it gets dark at 4 o'clock and rains every day. So at the left here, I'd like to bring your attention to where we're at today in green. The 25-27 impact solicitation will be released on Wednesday, December 17th, 2025. The application will be open for 38 days, closing on Friday, January 23rd, 2026 at 11:59 p.m. This period is represented in the dark blue, just to the left of this GRC meeting marked today. Staff will review all applications received between January 26th of 2026 through February 13th of 2026, shown in the middle of this timeline in the lighter blue. Application materials will be shared with the GRC during the last week of January. This is also the time period when research staff will conduct the bulk of the analysis and ratings of the GPOP, or Grant Program Operating Profile items. More on that soon. We will provide the sort of the bones and associated documents before that GRC review meeting in February. And then this GRC will meet sometime during the week of February 16th, 2026 to review applications and make award decisions. And that is represented by the green GRC meeting block, or on the right side of the slide. And after award decisions are made, the protest period will be open for 10 business days. shown here at the right in the light orange. And once that protest period is complete, the CJC will begin contracting, represented here at the right in darker orange. It's worth noting that each county and tribal government may have their own contracting processes and timeline, but the goal is to get money out to grantees by March 31st, 2026, so as to minimize gaps in funding for folks whose project periods closed December 31st of 2025. Because the new 25-27 project period will be July 1st of 2025 through August 31st of 2027, there will be an overlap with the current project period, and grantees will be permitted to backdate any approved grant-related expenses to July 1st, 2025.
Will, do you mind if I provide a comment real quick?
Of course. Of course.
Thank you. So we mentioned that this would be a condensed timeline for applicants, and that now includes both county governments and tribal governments. It's typically standard CJC policy to attempt to open an application for 45 days. And as Will mentioned, this application will be open just 1 week shy of that, so 38 total days. And that is, quite a bit of time in grant application world. So we did want to make sure we named it and said that it was indeed condensed. But as I'm sure Will is excited to share with you all, this grant program operating profile is hopefully, intended to really streamline a lot of this big lift of the narrative explanations that we have typically required in the past. But I did also want to note for any folks tuned into this call who may be considering applying for this next round of impacts funding, there are quite a few requirements that are mandated in statute and or rule. Will mentioned a few of them on a previous slide, and we'll get into some other details, but it is probably in your best interest to start soon. So the application does release this coming Wednesday on the 17th, and I know that's before the holidays, but to maximize the time that you may need to offer, meaningful consultation to tribal governments in a jurisdiction, or to coordinate with your LIPSIC and to get letters of support from community members, all of which are required per statute. I recommend that everyone start as soon as you are available to. Thank you, Will.
Of course. So thank you very much again for those additional comments, Co-Chair Beck. What I'd like for us to do now is move into the bulk of what we'll be discussing today. And over the past year, extending into 18 months, staff have heard this GRC's request for additional capacity for understanding and differentiating impacts programs. As we have discussed in the past, this is challenging given that local programs may share similar aims, but go about achieving those aims in several different ways. And so those differences have often led us to make apples to oranges comparisons, so to speak, and led to challenges in sort of evaluation and performance evaluation efforts. So to further help differentiate programs and allow for more opportunity for that meaningful comparison, the CJC is piloting a new addition to the solicitation called the Grant Program Operating Profile, which staff have colloquially taken to calling the GPOP. And this is the first time we're undertaking this operationalization effort at the CJC. And we know at the outset that this will not be perfect on our first attempt, but as Co-Chair Beck stated, our goal here is to take the important concepts that are outlined in rule and statute and in the scholarly literature, and rather than asking long questions from which we try to glean meaning, instead turn it on its ear and try to develop items or questions that can accurately capture the possible responses to that item that are specifically relevant to this high utilizer population. And so this would provide an opportunity to develop that deeper understanding of program parameters before funding decisions. And so I will share more details as we proceed about these concepts we intend to measure. But if we just, succinctly take one like identifying a target population, formally that may have had a long response, but we can further specify that and ask what sources of data are you going to use to identify a specific population? What thresholds or cut points may define high utilization for this particular concept? And then do you have some sort of potentially a process or an agreement in place that would facilitate the sharing of data across the local jurisdiction? And so we are excited to deploy this, and we are proud of this work. But we want to acknowledge again at the outset that there is no perfect document that will perfectly capture every detail from an array of unique programs. However, we are looking forward to receiving feedback from this GRC as well as applicants about these efforts. We will absolutely incorporate what we learn into future iterations of the GPOP. So this GPOP, again, whose contents we will discuss in greater detail in the coming slides, starts from a process that we undertook for another CJC grant program, specialty or treatment courts. And I will try to retain the use of the treatment court language here. But as you will see as we proceed, some of the acronyms still use the previous version of the name. And so for treatment courts, the Office of the State Court Administrator produced a similar operational profile document that was called the SCOP, Specialty Court Operating Profile. And each treatment court fills that out and returns it to the Oregon Judicial Department, OJD. And this operating profile provides important background information and context for understanding the program operations. And in the case of treatment courts, reflects adherence to published standards. And so IMPACTS does not have those same published standards. However, there are several other sources of evidence that the CJC incorporated into this GPOP work. We incorporated peer-reviewed scholarly literature, in addition to qualitative research conducted by our research partners at the Oregon Health and Science University, Portland State University School of Public Health, local program narrative reporting, as well as the SCOP itself to help guide the development of this document for IMPACTS and its contents. This GPOP captures a range of items that we will examine in greater detail in a couple of slides, but the reach here is intentionally wide. We have items in 3 sections that look at the program and its staffing and partnerships, another about the efforts to identify and reach the target population, going back to that how will participants be identified concept, and more detail about the day-to-day operations of the program, such as how long it's been operating. And we will cover each of these sections in greater detail in subsequent slides. We also expect these efforts to better capture program operating parameters will pay dividends for our research partners at the OHSU PSU School of Public Health as they continue their work with local program evaluation. There were a couple of important features that I wanted to share now to help frame this GPOP. The first of which is that it is intended to be used by proposed programs, which encompasses existing and new programs. The document does not capture the history of the program, but instead focuses on how it is planned to operate for this project period, knowing that slight modifications may arise along the way. This is intended to provide this GRC with a look at the program being planned for this project period of July 1st, 2025 through August 31st of 2027. Because this GPOP focuses on program proposals, the next question that many may have is about the previous performance of any returning applicants. And so for treatment courts, in this and the previous biennium, the CJC was able to operationalize this associated SCOP document alongside a limited number of data points to provide rankings to that GRC for funding decisions. And our goal is to undertake a similar process for IMPACTS, where staff will analyze the responses to the GPOP and provide this GRC with additional opportunities for scrutiny based on proposed programs. As I mentioned in the previous slide, this GPOP is designed to provide this GRC with opportunities to apply scrutiny to proposed programs in their internal operations at the time of funding decisions. We included 35 numbered items in the GPOP, some of which have one or more follow-up questions, querying additional details from applicants based on their selections in that item. If we use that same example from our previous slide, when it comes to identification of a target population, right? Whether a program intends to target high utilizers of criminal legal systems or urgent healthcare resources may be different answers. For both, however, we have follow-up questions that can help us identify where the data is coming from, thresholds or cutoff points that may identify high utilization for that specific jurisdiction, and whether the jurisdiction has agreements or other processes, potentially informal processes in place to share data across any silos in that local jurisdiction. So using the available evidence, which can include findings from scholarly literature, qualitative research conducted by our research partners, narrative reporting, or similar documents prepared by other state agencies, we hope to provide ratings for a number of the items in the GPOP, which would better allow this GRC to rank applicants. Not everything that we include in the GPOP would be rated for funding purposes. Some of these items may reflect capacity constraints or differential access to resources. And for items that may meet this criteria, we hope to provide this information to the GRC, but as a recommendation, which would not be rated for funding. Finally, there are just a few items that are included to help deepen this GRC's and the CJC's understanding of program operations and potentially allow for better program categorization or bucketing of similar programs. And so my plan for now is to walk through the 3 sections of the GPOP, pausing after each. And if this GRC identifies questions or comments about that specific content or section, please let me know and I would be glad to answer any questions before we proceed.
I am seeing a hand up, Will.
Okay.
I know that your screen's tiny. I think
Thank you
Alicia
so much,
Beaver.
Avery.
Mhm.
Yes, Alicia Beamer.
Yes, no, I really appreciate the thought and all, and just how this is really well outlined. Is this the first time that the grantees are also hearing about this, or, and you may have mentioned that, but just wondering how this is being socialized with that group? Thank you.
Yes, thank you so much for the question. I believe this may be the first time for many of the applicants who are coming to the Impacts Grant Program, yes. I am afraid at this time we can can hear from the GRC members. The opportunity for public comment has passed. Were there any other questions or comments from the GRC at this time?
I guess maybe in follow up to that, how will grantees be able to provide feedback then, maybe, or just?
Yes, that process can work in a number of ways. We anticipate that this being the first time that it may not fit perfectly. So we included opportunities for other responses or unknown, just to say that we don't know, as part of as many items as we could. And then as well, part of the sort of instructions in the top, if something is confusing or the applicant is having a hard time sort of differentiating the intent there, we do ask them to reach out to the CJC. And then once this process is further along and once the GPOP, we have gotten those responses, we absolutely will undertake a process of feedback about it. And then my understanding is we also anticipate a Q&A session in January.
Thank you. Appreciate that.
Of course. Thank you. Any other questions from the GRC before we proceed? Okay. So section 1 of the Impacts GPOP is the shortest, and it contains about 5 items that will help us begin understanding the proposed programs. And these largely relate to their core staff and partnerships. Aside from the author of the GPOP, the person who's filling it out for that applicant, information related to proposed staffing as well as proposed program partners are included. So we are not asking for individual names, but rather attempting to glean a better understanding of the structure of the program here. We want to have a clear understanding of who is completing the work associated with the Impacts program with this item. And so if, for example, a proposed program says that they will fund a peer physician, a care coordinator, and a medical provider, we might expect that this team would be providing team-based care unless otherwise stipulated in their application. And then similarly, the embeddedness of a program within a local jurisdiction could be understood, at least partially, through the number and types of partners proposed for the program. And further, this can help us better understand whether and how the proposed program can cut across the well-known silos associated with high utilizer work. And then finally, this section has a couple of items relating to the team itself and its internal processes. We ask items about whether and how participant progress is shared with core team members on an ongoing basis, as well as specific strategies that local programs anticipate using as part of their own internal fidelity monitoring and improvement processes. And so I am glad to pause here before proceeding in case there are thoughts or questions from the GRC at this time.
I'm seeing no hands, Will.
Thank you. Okay. As we proceed into section 2 of the GPOP, I will warn you that section 1 is the shortest, section 2 is longer, section 3 is longer still. And so we turn our attention away from sort of internal program workings in section 2, and we start identifying whether and how the proposed program will or could reach the intended target population with behavioral health conditions. And these are defined in rule as a mental health disorder, a substance use disorder, or co-occurring disorders. And so one important feature of impacts programming remains the link to behavioral health. And we have an item in the GPOP that captures the ways a local program may verify the presence of the behavioral health condition at the eligibility stage. For example, by using electronic records like an electronic health record or self-report. There are other choices, those are just a few examples. And so a second critical program feature is whether and how the program reaches high utilizers of criminal legal and healthcare systems. To focus, as an example, on criminal legal utilization, we ask whether the program intends to reach this population of high utilizers. And so if the program says, yes, we are trying to reach high utilizers of the criminal legal system, then we say, okay, how, right? Which specifically? This could be law enforcement contacts, it could be jail bookings, it could be parole and probation contacts, it could be any number of these. And so if we focus, for example, on law enforcement contacts and jail bookings, for each of these two, we would be asking follow-up questions about, well, how are the data collected, for example, from jail booking records? And then what threshold or frequency would define high utilization for jail bookings? And the answer could be 4 or more jail bookings, for example. And then there's a checkbox that indicates whether there is some agreement or process in place to facilitate sharing that jail data, in this example, within that local jurisdiction. And so as we proceed down, identification strategies can take 2 broad forms. And we are asking applicants to tell us which strategies they anticipate using in terms of direct referrals, as well as system reporting. So a few examples that we have as available item responses for the direct referrals could be a self-referral, for example, or a facility-based intercept where someone is stationed, for example, in the lobby of a particular place, trying to identify folks in the target population at that place of high utilization. A couple of examples from the systems list could be reports from the jail about individuals who have had 3 or 4 or more bookings in a particular period. Similarly, it could be a report from a health organization that says this person has, or these people, excuse me, have been to the emergency department and admitted more than 3 or 4 times in this past time period. And so finally, this section captures the program participant capacity monthly, as well as any disqualifiers for participation, including whether those disqualifications are for the short term, perhaps associated with a particular criminal case for a time period, maybe 3 or 5 years, or potentially forever. And so we provide a list of common disqualifiers, and then if that is a disqualifying, it can be indicated at the time as well. And so before we proceed to that third section, which again is the most robust, I want to pause again for any questions from the GRC members. I'm seeing no questions at this time. Okay. So next we have the final section of the GPOP, which examines several additional program parameters that we hope to capture and allow this GRC to use as part of funding decision making. First is program maturity, which helps us better understand how long the proposed program has been operating or whether it is newly proposed and ready to begin operation. Next, as we have reflected in the illustration for this slide, which sequential intercept or sequential intercepts does the program anticipate operating? We also ask about planned recruitment strategies employed by proposed programs. So whereas in the last section, we talked about how you identify your target population, in this section, it's more about what strategies will you use to recruit those folks. And these could be just a few examples, a cold outreach, maybe texting a number on file, all the way to a more peer-led approach or a warm handoff approach. And these next few items could be categorized together and help better understand the steps and stages nearer the time of participant enrollment. We have items capturing the primary way that participants enter the program, which could be, for example, formal voluntary enrollment, or it could be low barrier / informal enrollment, among other response options. As well, details about when an individual becomes a participant in a program, which again, just a few examples could be at first contact. It could be at the first service delivery, or potentially participants may only be identified retrospectively after the fact. So the next item about engagement goals will help us better understand the intensity and duration of the expected engagement by the participant. So engagement could be a shorter term, potentially in like a crisis stabilization situation, or it could extend indefinitely in a more potentially like an assertive community treatment model. And finally, these last two items relate to whether and how an individual may complete a program or reach a logical endpoint. Some programs may be time-based, for example, others may be milestone-based. And then expected participant outcomes will allow programs to select whether they aim to reduce jail bookings and or ED admissions and or improved quality of life, among other selection options. So we have one more slide of concepts for this final section of the GPOP, but again, I'm glad to pause here before proceeding in case there are questions from the GRC at this time. Okay. Hearing none. Okay, so continuing with the final section of the GPOP, we have additional items that we will capture, to better understand program operations. The first of these is whether the proposed program, has written eligibility criteria, policies, procedures, and or other program documents. And we request that proposed programs submit those as part of their application so that this GRC may review. We also ask how these are shared within the local jurisdiction to local referral sources. Next, whether the program uses eligibility screening tools for potential participants and whether participants are provided with a needs assessment upon enrollment. We also ask about categories of additional screenings or assessments that are available for program participants, like the ASAM, physical health assessments, or SUD assessments. Next, we ask whether individualized treatment plans are developed for participants and whether those are shared with other team members. And for this next section that discusses diversion, as a reminder, This is the statutory purpose of the IMPACTS program. The goal is to reduce the number of jail bookings and reliance on emergency departments and Oregon State hospital beds while improving capacity for community-based treatment supports and services. And so here is where we will capture not just the intent to do so, but the strategies that the proposed programs anticipate using as well. Some programs may focus on jail diversion or other criminal legal diversion versus ED diversion, for example. And the presence of these strategies is a point that we can use to better understand program operations. We also provide a robust list of evidence-based practices for proposed programs to select whether they provide those as direct service or refer those out for those evidence-based treatments and practices, or in some cases, both. And of course, we don't expect that every program will offer every service. Again, it's just a better way to understand the offerings available. It is also our hope to better categorize the proposed programs according to the presence and the permutations of these evidence-based practices that are found in their proposed program. And the GPOP ends with 2 items relating to the levels of care that the proposed program has available for participant referrals. And so next, my goal is for us to discuss the plan for returning applicants in terms of better understanding their previous performance with IMPACTS. And after that, I will explain staff's plan to take what we learn in the GPOP and turn it into scorecards or rating rubrics that can be used by this GRC to help better understand programs and rank or rate their proposed programs against this GRC's priorities to make funding decisions. So again, glad to pause here before proceeding in case there are questions or thoughts from the GRC at this time. Hearing none. So this GRC has expressed interest in having a clearer understanding of performance by existing IMPACTS programs during several GRC meetings. We expect that some current IMPACTS grantees will apply again, and staff plan to include specific data points alongside GPOP items that are relevant to those returning programs for your consideration. We want to acknowledge again that programs have varying levels of funding and capacity to serve participants, and we try to select data points that can show different views of performance. Importantly, given the variation in how some programs remove participants from their roster, which is an explicit item in the GPOP, by the way, whether and how the proposed program anticipates a logical endpoint to their programming. We are utilizing the most recent 5 quarters of available data for this review period, which means that the date range under review in the data that staff will provide is July 1st of 2024 through September 30th of 2025. Or the 5 most recent quarters that we have. And so staff will include a limited number of data points outlined here. First, the number of newly enrolled clients during the review period, which helps us better understand inflows to the program. Next, the number of returning clients during the review period, which considers the available program designs. Some programs have shorter term engagement goals, while others have more extended engagement goals. And again, that is captured in the GPOP. In some cases, local programs may still be serving participants who enrolled from years prior. And so we are also including a view of the volume of service provision to returning clients. And finally, a measure of the spending patterns for the previous programs for the previous biennium will be included so that this GRC can examine those spending patterns as part of the broader proposed program for this biennium. I will pause here before proceeding in case there are questions or thoughts from the GRC at this time. Hearing none.
Well,
Yes, Steve
do
got it.
see. Yes.
Hi there. Hey, is there a way to measure efficacy of programs or recidivism rates, things like that?
The issue that we have had in the past with IMPACTS is that the local programs do not provide identifiers in the statewide database. And so things like recidivism would be challenging for that review. So that is, recidivism would be a big challenge as a result of that, sir. Glad for any other additional questions or comments from the co-chairs. Okay, so my hope with this slide is to tie these things together neatly. As I have discussed, staff anticipate following a similar pattern to that which the specialty court or treatment court grant program has taken in previous biennia and the current. And the goal here is to lighten the lift for as many parties as we can by removing many of the open text field responses and replacing those with multiple choice, multiple select, or checkbox or drop-down questions. We expect the lift to be lighter for applicants. We also hope this process will lighten the lift for this GRC because once these applications have been submitted, staff plans to pull out the items from the GPOP, analyze those using our statistical software to generate ratings for a custom scorecard or rating rubric for the impacts applicants and provide these to the GRC alongside those data points for returning applicants for decision-making purposes. It is at this point that we hope to generate the primary model that we can discern from applicants as a bucketing mechanism. And some items in the GPOP are informational only, as I have mentioned, and will not be rated, but those responses will also be provided to this GRC to help develop the deep understanding of proposed programs and provide the capacity to make the most informed decisions related to funding. In February, it will be up to this GRC how those scores would be utilized in the decision-making process. The score could be used outright, for example, as a relative ranking, or additionally, we can examine different means of weighting the scores to match the priorities of this GRC. Staff will ensure that we dedicate sufficient time before the next meeting to generate a menu of options for this GRC to consider before the application review meeting. So I will pause here before proceeding to discuss GRC priorities in case there are thoughts or questions from the GRC at this time. Okay. So as outlined in the Oregon Administrative Rules, the Grant Review Committee shall review and evaluate each grant application based on the following criteria. Number one is application completeness. Number two is a program narrative and local system assessments, which include the overall responsiveness to impacts program priorities, including but not limited to the degree to which programs are designed to reduce the number of jail bookings and emergency department hospitalizations for the target population, in favor of diversion to coordinated community-based treatment supports and services, as well as the method of identifying and serving members of the target population, as well as the applicant's explanation of how requested program supports and services would be integrated into existing behavioral health programs, including how they can maximize coordinated care organization engagement and how they do not supplant or duplicate existing sources of funding. And then moving to number three, a sustainability narrative, including whether an adequate description of the applicant's plan to sustain impacts programs through multiple sources of program funding was provided. And finally, any other criteria included by the Grant Review Committee in the request for grant proposals. And so it is here that I'm hoping to connect several related pieces of information and things we've been reviewing in this meeting to these specific application review criteria. And so the GPOP is intended to capture information relating to several of these criteria. So items related to the intent and strategies for reducing or diverting from jail bookings and emergency department admissions are reflected in those items about diversion in the third section of the GPOP. Further, section 2 of the GPOP specifically gets at the method of identifying the target population. And then again, the third section of the GPOP gets at this serving that target population, including, whether and how these are integrated into existing local infrastructure. And then we classify the remaining items in the GPOP as pertinent to the fourth item here, that any other criteria included by grant review committee or grant proposals, with the idea that it is the combination of these items which will offer the clearest picture of proposed programs and provide this GRC with the opportunity to apply scrutiny as a result. And so this next slide that I have offers a review of past priorities for your consideration today. And I am glad to pause here for questions, however. So in past solicitations, this GRC chose to include the following items as additional priorities. We can include these without changing the application questions and solicitation as they are currently drafted. So the question is, would the GRC prefer to keep these in? Or is there anything in particular that you'd like to change or remove? And I'm happy to read those. So these are adhering to the program's statutory purposes, tracking, evaluating, and measuring system data and grant-funded program outcomes. And then the third is strategically leveraging limited grant funding resources by supporting a select number of programs who are with willingness to participate in data sharing and analysis that have evaluated local system gaps and available supports and services for the target population, that are able to sustain comprehensive services for the target population, that have exhausted local solutions and resources, and at funding levels sufficient to ensure limited grant funds make a significant impact in the local community selected for investment. Yes, Co-Chair Beck.
Hi, thanks, Will. I wanted to provide a little historical context, especially for the benefit of some of our GRC members who may have not participated in the last couple of rounds. So these priorities were included in the 2020 request for grant proposals and the 2022 request for grant proposals. And they were, intended to give applicants an idea of what additional priorities the grant review committee may apply during the funding considerations as part of the award decisions. And they fall under that number 4 criterion that Will had displayed on the previous slide of any additional criteria that the GRC may want to include. And for transparency purposes, we just want to make sure that if any of these things are things that we want to potentially prioritize as part of those award decisions, that they're included in the solicitation so that applicants are aware that these are potential priorities. So just wanted to speak to that. And I see Judge Shanti and Stacey Brubaker may have comments as well.
Judge Shanti.
Well, can you guys hear me?
Yes, Judge Shanti.
Yeah, okay, great. So we had these last time, and I'm wondering, I got that this is a new grant process, but if we keep these in there, are we going to be able to look back at any data from the people that have already been in the program, had programs going, to see if this is actually happening? Like, for instance, I know early on we had problems with data sharing because people weren't up and running and didn't have the programs and all of that. And so we've already said to them, a lot of them, I'm assuming that a lot of these will be continuing, not new applications, but continuing programs. We've already said that these are priorities. And so I guess what I'm wondering, if we keep these in, can we look back and test what they're saying based on what we know from what they've already done?
Judge Shanti, thank you for the question. We have a limited number, 4 data points that we intend to include for programs for applicants that are returning applicants. And these may help answer some of these items, or at least potentially speak to some of these priorities, but I'm not sure that it would be potentially as robust as meeting and measuring each single priority here.
I would add too that it would be possible to think about maybe these priorities applying a little extra to returning applicants. Maybe that's something that the committee wants to consider. Of if you are a returning applicant, you know, we want to see prevalence of data use agreements and memorandums of understanding for data sharing. And we want to, you know, see a sustainability narrative that is considerate of what resources are available. I think that maybe that's a way that we can look at past programs to see if they're, you know, up to snuff this time around.
Thank you, Co-Chair Beck. Stacy Brubaker, I believe you were next.
I was just curious whether there is, for bullet C under 3, what the definition might be for sustain. I'm not sure the applicants would know what sustain means, whether that means you can use these dollars to basically replace the dollars you're losing to be able to sustain the service, or if you're asking how long with these dollars can they continue to provide the service they're proposing.
Hey, Avery, would you be able to look at potentially the application question, that budget question, so we can look at that more carefully?
Of course, I'm pulling that up
Thank you.
now. Yeah, so we do have several questions as it relates to that point in the section C of the application questions that you all received. So we do ask questions regarding like what funding sources currently support the program, or if there will be like a braided funding design. Additionally, we ask how the organization plans to financially sustain the impacts programming beyond the 25-27 grant period, and then the type of organizational support that is currently in place for sustaining the impacts program. So I do think we get at that question through several different like checkbox questions.
And Stacy, thinking about your question too about how would the applicant interpret the word sustain, I think as Avery explained there, when we're talking about how would folks think about impacts programming beyond the 25-27 biennium, keeping in mind that these are limited grant funds and that it's a competitive process, and that we are, you know, encouraging folks to actively seek out other ways to permanently fund a high utilizer program in their jurisdiction. So I think that is the sustain here is meaning beyond the end of these funds for this grant period.
Okay, thank you.
Thank you. Janie Gullickson?
Yeah, thank you. I was wondering if we could either revisit or clarify under 3D that they have exhausted local solutions and resources, especially for returning grantee applicants. What do we mean by exhausted, especially if program funds previously have helped lift up some of these services, and if there's braided funding or collaborative processes? What do we mean by exhausted?
Thank you, Janie Gullickson. That exhausted, that is a great point. If there is interest, this is something that we could remove from this round of priorities, if that is of interest to this GRC.
I think for what it's worth, Janie, you make a good point. especially for those returning applicants, considering those programs right now. And it's worth too, I guess, in the solicitation as drafted, which I know that GRC members received, these priorities for consideration come with a big may be applied. So we definitely can consider striking D from those priorities. And we also can maybe rest assured that, we don't necessarily have to apply every single one of these come award decisions in February.
Janie, I just want to make sure that we have.
Yeah, thanks. I do wonder if that's something we can either provide more clarification by what do we mean by that? Because this isn't, again, like other grant funds that are out there. It's not meant to be the end all be all, and that there may be some small gaps. This is not a huge amount of funding. And so, yeah, and we already say that it's not to be used to supplant other funding sources. So I think we've been clear there. I would like to bring that to the group, just to see if there's other thoughts or ways of phrasing that. What do we mean by this now, 5 to 7 years later?
Thank you. Okay, so absolutely heard, Janie. Judge Shanti, is this, or before we move to Judge Shanti, I'm not sure if your comment is about this or another topic, Judge, and so I just want to make sure that we have this discussion. Do any other GRC members have feedback or other potentially means of reframing or rephrasing this item?
Is it just an expanded question that we want to know how funds are being used instead of that sort of very straightforward, exhausted local solutions? Where's the breakdown on the funding sources and what funding you have used or what funding will continue? That type of thing it may be just expanding that question to provide additional information. I think that's what Annie wants to see.
Thank you, Sheriff Hunter. GRC, are there any other members who would like to contribute to the discussion of this item?
Well, I guess I'll add that, with that comment from Sheriff Hunter, it maybe makes more sense to strike D completely. I would be curious if any committee members have any objections to removing that, knowing that we do have 3 very robust, kind of sustainability and budget questions as part of that section C of the application, as Avery mentioned, where we do ask folks to identify what funding streams they're using to support this population, how they're going to sustain things financially, but also with organizational support. So maybe we can get the information we need out of those questions, and we don't necessarily have to prioritize the exhaustion of local solutions and resources. But I'd be very curious to see if folks have any other, pieces of heartburn around removing that. All right, I saw a couple of thumbs ups, and these are not action items per se. It's more about just getting kind of consensus as we move forward. So with no objections, I think, maybe it's safe to say that this committee feels comfortable striking D as a potential priority for consideration. Doesn't need to be prioritized this time around since we'll be getting some good information from our budget and sustainability narratives. Thank you, Janie, for that idea.
Thank you, Janie. Co-Chair Beck, Sheriff Hunter, and members of the GRC. Judge Shanti.
Oh, going back to what Ms. Beck said, it could maybe be an approach to talk to figure out about past programs and what they're doing. Here's what I envision. I envision myself looking at these applications and wondering, what have they done? How successful have they been in doing what we asked them to do 5 years ago? And, you know, it's built over the number of years. And now we're kind of tapped out of our money. We've got a little bit of money left, and who knows what's going to happen next time. But in measuring this, I really am not inclined to give more money to a program that hasn't done what we've already said that they should do and what we already set priorities for them to do. And so there's a little bit of a disconnect with it being a clean slate for everyone applying, right? So there could be a brand new program that I'm going to measure differently from the programs that have been in existence, in the sense of, can they actually achieve what this money is supposed to be going to? So this is one way, is looking at the past priorities and doing what Ms. Beck said and saying, okay, so if you've got a program in place and you've already gotten a bunch of money, what have you done that's met these considerations? Now, there might be some other considerations that we would like to measure. Like, frankly, for me, if some program has gotten, you know, $200,000 and they've had two people, a two people benefit to the cycling through the criminal justice system, I might be thinking, wow, that's not really a very big bang for the buck. But we don't have, apparently, we're not going to have that kind of data to make those assessments. So I would like to get some feedback from the applicants, like, how successful have you been? This is one approach, is to say, well, tell me about this. And we were told just a minute ago that we could add stuff to priority considerations. And I would like to add something like, to get at this, how successful have you been? It doesn't have to be the data from you know, the number cruncher people, but from their own perspective. How much have they achieved? How many people have we actually helped? Because that's what this is all about, right? How many people have we helped and diverted from getting bogged down in the criminal justice system, sucking up energy from the ERs? So I guess I'm open to how we could do it. Ms. Beck, you had a good idea here. I would like to maybe add something like, how many people have you helped, or what's your narrative of how successful you've been, something like that, so that we're not pouring money down the hole and we're really actually boosting the programs that seem to be making progress.
Thank you, Judge Shanti. Co-Chair Beck.
Thanks, Will. Yeah, Judge Shanti, I agree that this might be a good spot for maybe a narrative asking for returning applicants only. And I did want to highlight that some of the things you mentioned, you know, the bang for the buck, and, you know, how much money were you provided, how were you spending it, and how many folks were you serving? Those are actually additional criteria that we are requiring of all returning applicants. So there are 4 data elements that anyone who has received impacts funding before, the CJC will be pulling from that REDCap reported data between this review period of July 1st, 2024 through September 30th of 2025. So like the 5 last quarters, well, almost the 5 last quarters of the program, just I guess one short of the last quarter. But looking at of the money that you were allocated, were you spending it, and to what extent? And of that amount of money, looking that in contrast to the number of folks that you were enrolling into your program during that review period, and the number of returning clients that you saw and provided service to in that review period, and the volume of that service provision in that review period. And so I imagine, thinking of future us reviewing these applications, I imagine there being this GPOP score that will kindly walk us through all the different elements of the details of the operations of these projects as they're proposing to do so in 25-27. And right, we're not going to have a full picture of the history of what they did do, but we're going to have a great idea, a very detailed idea of what they're going to do. And then for the folks who are applying again and had previously received funds, we're going to have these 4 additional data points on top of their GPOP score, in which we really can take a look at how did they do in those 5 quarters of the review period, and does that look different to another applicant that may be reapplying. So I think we might be able to get at that. At least that's my understanding, and Will, please correct me if I'm wrong.
So can we add that narrative question then? Can we ask them to provide this information that's in this slide and a narrative of how successful or what particular challenges they think will be overcome if they haven't been successful, something like that, so we get a view of their own assessment?
I think that's appropriate. I saw ahead, I think, is it possible operationally? So I think, yes, indeed, we can include that for returning applicants.
Alicia Beamer.
Yes, thank you. I had stayed quiet on the exhausting local solutions and resources in removing it, and I do support doing that, especially given how resources are. I have no doubt that resources are being exhausted locally right now, especially as resources are we're seeing cuts in many services across the board. So. And support replacing that with that dialogue that Judge Shante was talking about. Having been on this committee for the last 5 years since the inception, I agree. I think Judge Shante is really speaking to something we've talked about since the beginning, which is we talked about how do you replicate these services as well across this. I would just like to add on to that conversation. How do we are some of these services, can they be replicated across the state? So maybe if we're asking the applicants to state how successful have you been, and to articulate that, an added question would be, can this be replicated? Do you support this replication across the state? Would there be value in that and exploring that for other counties? Because it has really served the population that we're striving to serve, the high utilizers of the criminal justice system, as well as the emergency departments. Thanks.
Thank you, Alicia Beamer. Sheriff Hunter.
What the judge has to say, I appreciate what Alicia just has to say. I think there is a issue that we have to look at, though, when we want this additional information, is we have to have context to the additional information. One of the issues that currently exists is in the word that was just used multiple times, which is success. And all of the different jurisdictions have a different definition of success. And so without consistency in that, I know Casey mentioned REDCap and what comes into REDCap, but how are we utilizing REDCap? Are people actually putting their data into REDCap? And then are we looking at a per capita piece as to how we're defining that? Because if somebody's success is defined over here and there's a very low bar for success, yet you have somebody else's definition of success over here, and there's a very high bar for success, you're going to have a significant discrepancy in the data that you're actually reporting. And so I'm a little concerned with just asking the sort of blatant question of how have you been successful? I agree with, I think, where the judge was going and Alicia was supporting. We've got to have additional information that comes into that is some sort of an analytic measure that is telling us how you're arriving at your definition of success. Because if we just push it out to people, because someone shows up at a door is not success for helping somebody. I appreciate it that you got them to the door, but if you're not going to walk them through that door and you don't have objectives for them past that doorway, I have a hard time, or Marion County would have a hard time, at least from my perspective, saying that that was a successful interaction or intervention into that person and a good use of those funds. The other issue that I know we're starting to see, and it's not the conversation here, but if we look at 3069 and what that did with the CJC and the grants, there was an arbitrary metric that had no foundation that was applied to those dollars. And so the more that you conjectured, and I'll use any new programs that come into this, if you conjecture and you say, by the way, we are going to work miracles, we actually rewarded those people that said they were going to work miracles, but have absolutely no data behind how they're going to work miracles, nor do they have any experience in trying to actually do so. And so to this point of wanting more information, I think that there has to be context to the information, and we have to start defining some of these objectives, goals, outcomes that we want to see, and how are you achieving those, not just sort of giving me arbitrary information that you all sat down at a table and said, hey, I think this is what we can do. I think I would rather see some actual analytics and data behind that. Thank you.
Thank you, Sheriff Hunter. There are, I do just want to, I noticed that a co-chair came off of mute, and also Judge Shanti. I don't want to delay the conversation, but what I do want to say is that we are moving in that direction. Certainly with the items in the GPOP, there will be capacity and space to see specifically what proposed programs are trying to do. And then for diversion, for example, we have very places for them to provide us with that exact strategy that you're asking for, so that those reasonableness determinations would be facilitated by this GRC at the decision-making stage. Judge Shanti, I don't want us to move too far away from this point. And so is this related to the same point, Judge?
Yes, it is.
Wonderful.
So
Please go ahead.
I appreciate what the sheriff is bringing up. And of course, you know, even before this committee was designed, in the first planning committee, I don't know how long ago that was, 8 years. I don't know, Alicia Beamer was there. That we were struggling with this exact issue. And part of the problem is rural counties, big cities, you know, different per capita. Well, maybe Eugene can be more successful per capita than, or less successful per capita, who knows, than a Lakeview. It's a little bit of apple and oranges that we've always been dealing with as these programs have been designed, because of the different resources available to the different counties and the population and all of that. And it is really hard, as I've been sitting here for all these years, I think it's even hard for the data brilliant analyst people in Portland to figure out across the board what is the equal criteria that we can apply. So my suggestion about this narrative was really to get them to tell us in their own words, how successful have they been? And when I say successful, I think there's a statutory definition for successful. the statute says what we're trying to achieve is reduced ER visits and reduce criminal justice penetration. So if they can say we have, you know, had 10 individuals and we've reduced the ER visits of those 10 individuals, I don't know, by 25%, we've reduced police contact with those individuals by 50%, then that's success. They're using the term. So maybe in the question we say, the statutory definition of success is, have you done this? Have you reduced people recycling into the criminal justice system? Have you reduced ER visits? We know what success is. The statute says it. And then ask them how they've achieved that or how successful they've been. And my experience is we'll get all kinds of different narratives. Some people will be focusing in on that, and some people will be focusing in on, you know, the 3 people whose lives they saved, whose families were positively affected. And so we might not get the data points the sheriff wants, but maybe with that narrative plus the data points we already have, it'll help us go forward. And I also like Ms. Beamer's suggestion, because I think, isn't our committee done in July? And then this goes to you guys, the CRG, the Criminal Justice Commission is going to take it over. Is that right, Casey?
That's correct.
All right. So we're at the end of our road, and it's been a long road, and you guys are wonderful, and I'm really grateful to be part of this. So, but maybe in this last round, that's what the best we can do, and ask them, okay, now, do you think your program we can leverage this? And some of them might say no, because it's very unique to Union County. And you know, and some of them might say, Eugene might say, yeah, you know, we think this program, it can be leveraged on any size county. So I don't, you know, I'm just saying Eugene, it could be Portland, it doesn't, Marion County, it doesn't matter to me. But anyway, so that's my suggestion with that data point. And then Sheriff Hunter, if you can figure out a way that we can get that across the board, equal application stuff, you are brilliant and probably need to be working in that think tank in Portland, because they haven't even been able to do it yet. But thank you for your comment, and I totally agree with you. That would be what the ideal.
Co-Chair Beck.
Thanks. Judge Shanti, thank you so much for your additional comments. And I think that narrative is going to be the best way that we can get this information. And to what Sheriff Hunter was speaking to, I think that is exactly what we're laying the ground for this time. Sheriff, you mentioned House Bill 3069, and you know, impacts is not exempt from those changes coming in the 27-29 biennium. So I imagine this grant program operating profile being kind of this baseline of what you're doing, what you're promising to do, and then to a comment that DA Gunnels made at the very start about efficacy, really thinking about when future funding is available too, going back to that baseline GPOP and seeing how you performed against that, and then continuing to include data points that have now gotten, you know, much more intentional and detailed in the collection of the REDCap data, as our, you know, research partners at OHSU have, you know, begin to hone in on those outcomes that we're all talking about. So I think that it is appropriate to ask returning applicants, like we can, you know, figure out either a way in application questions to say, are you a returning applicant? Yes, no. And if yes, then the new question will pop up that captures what Judge Shanti's getting at, but also what this GRC is getting at of, you know, share with us how successful you have been in your efforts for impacts. And Judge Shanti, I think you're right. I think some folks, or who are returning applicants will probably be able to provide data and methodology and really detailed information on exactly, how many or maybe how many costs were avoided by their efforts, and that and other jurisdictions. I think, the rural areas, maybe some tribal governments, they might be able to share success in a different way, and maybe some ways that are difficult to quantify in dollars or time, but maybe lives saved, and quality of life improvements. So I think defining it, as like hey, here are the impacts priorities. It's reducing the number of jail bookings, and ED visits, and institutional placements. How did your program do that if you were previously funded? And then we can come back together in February with those responses from returning applicants and take a look at it with a very scrutinous eye.
Thank you, Co-Chair Beck. Sheriff Hunter.
My comment is quick this time because Casey actually just hit it. On that piece, when you are providing analytics data, whatever that is, I think it is a simple statement on there, Casey, that how did you arrive at this data? Not just give me a number, but how did you arrive at this number? Because then it does get right back to the judge's point of every one of our jurisdictions is different. And so we can apply that success measure, and that success measure of being reduced visits or whatever it might be. But how did you arrive at that? That's what I want to know, because that is what's often manipulated. And so that should be the point of discussion if we're really looking back to what Gunnels had to say about efficacy and recidivism, which not everyone has that data. But how did you arrive at the measure that you're providing that you want this committee to review? How did you get to the data that you're giving us?
Thank you, Sheriff Hunter. Avery, I just want to provide an opportunity if you want to make sure that you've captured the discussion for the minutes.
Yes, thank you, Will. So what I'm hearing is that the GRC has come to a consensus to remove D from the priorities, and then to add something to the priorities about how successful past programs have been, or returning applicants, as well as adding a question or questions to the application that speaks to how successful have you been for returning applicants, and basically how are you determining that, and how did you get to your numbers, and that we would also add to this list of priorities if this program can be replicated, and this would be for all applicants, and we would also add a question to the application as it relates to that.
Thanks.
So that
Avery.
is what I'm hearing.
I think the only addition, I guess, for the record, speaks to the Judge Shanti's comment about defining success. Looking at our organ administrative rules, I think we have it pretty well laid out. There's, let's see, OER's chapter 213, let's see, 030-0051, grant application review criteria, speaks to any program narrative, which could include the overall responsiveness to impact program priorities, including but not limited to the degree to which programs are designed to reduce the number of jail bookings and emergency department hospitalizations for the target population in favor of diversion to coordinated community-based treatment, support, and services. So I think that could be, here's what we think, the goal of impacts is. How successful were you and your program in, getting at that goal as defined in rule, explaining any methodology behind that success determination. And I think that gets at what Judge Shanti was hoping for with a definition. But Judge, if you have any other comments, please feel free to pop in.
That's it. I think that would be great to add.
Thank you, Judge Shanti. Sheriff Hunter.
I just listening to what Avery just said, and then Casey kind of followed up, but I don't think we have to just limit this to our existing programs. I think basically the same question can be asked of those that are new programs that are now asking for money. I think when we're looking at new programs, two questions come to mind. One is, where have you reached out and have you consulted any existing programs in building your program or your plan? I would be interested in that. Are you trying to reinvent the wheel? And nothing is in perfect parallel, but you can take ideas that have existed and figure out how you can adapt or apply or reject those depending on jurisdictional issues. And then the second question that I want them to answer to is, again, along that lines of success, if you are now essentially conjecturing that you're going to serve this population or achieve this result, what is your basis for that? I want you to explain that argument about why you think that you can do X with your new program, if your new program is funded with this money type thing. What is it that you're using as and I realize you don't have the past analytics, but what are you using to create your numbers that you're presenting to this committee as to saying, this is what I can do? So I think it works for both the existing programs, but I don't want to take it off of anybody applying a new program. What have you done to put this package together that you're now giving to us? And especially if you're including any analytics, how are you arriving at those? That same question is applicable to our new applicants.
Will, might I add something?
Of course.
Thank you. I think that's a great point, and we'll take a double look at the application questions. I do know that a lot of that, like success, like how are you going to determine success? What are your primary outcomes? All of that exists forward looking already. So we can also make sure that it has that how piece in there.
Thank you, Avery. Judge Shanti?
Well, I was just going to say similar is that it seems to me that most of that is in the application data itself, like that question. And I can, with pretty good certainty, say that if this is a new program, they have no data. They have nothing. They'll be building from scratch and they'll be scratching their heads for a while, and this will be just a startup for them, and then they'll have to figure out how to fund it later unless the legislature does. Because if you're not already on board, that took the first round, took most programs the whole biennium just to get the data, figure out how to collect the data, what the data is, do the contracts with the ER and law enforcement and all of that. So if they already have that, they've already got a program, in my view. So, and all the rest that the sheriff talked about, I think can be captured in those the actual application responses to the various questions.
Thank you, Judge Shanti. Janie Gullickson.
With the discussion that's been happening, and I'm very excited about the things that are being considered and brought up. I think about the GPOP and under resources and references, and going back to seeing the mention of the sequential intercept model when it was referenced. So wondering if we can add the link to the Oregon state map or the county map of sequential intercept mapping exercises counties have taken on, because if we're mentioning it and even by adding it in there, seems like it would encourage folks to reference it or know what it is. And some counties have not done a mapping exercise in over 15 years. And so I wonder if there and the system and gaps in the system probably look wildly different from 15 years ago, and even the issues we're trying to address. And that brings a lot of cross-sector people to the table. So I wonder if there's an encouragement or at least a link to that website that shows the work the counties have done and when. And I think what I'm hoping comes out of that is that counties will want to do a more current mapping exercise, because I think that would identify a lot of the things that, including cross-sector data and collaborations that hopefully we're seeking. I hope that made sense. There was a lot going on in the brain. So
Thank you so much,
for
Jane.
letting me bring that up.
Yes, of course, just to make sure that I have it captured correctly, adding the link to the sort of the link to where the location of an Oregon map with the specific or jurisdiction specific SIM map work that has been completed over time, and including that as part of the item so that it's a quick and easy reference to that work. Yes. Thank you very much.
Great summarization. Thank you so much.
Of course. Alicia Beamer.
Yeah, no, thank you. And thanks, Sheriff Hunter, for joining this committee. You've brought up lots of really great ideas in conversation. But I was wondering, as far as the data goes, I think, when we started this and started awarding the grants in 2020, we did not have the 3% that we've been dedicating of data collection. So I think, we've done this 2 times now, right? Where we've approved grants. So that's $600,000 that we've had in data, in money that we've put aside for data review and support. So I think we're in a different spot. And then if we allocate this next $300,000 for this grant period, I think we're in a different spot than we were in 2020 as far as collecting data and being able to evaluate that. And is there a way, especially for the new applicants, to be able to reference some of that existing data that they have, so they're starting actually ahead of where we were in 2020, and being able to really articulate, this is our current state, and we can leverage current data and future data to show the benefit in our programs, if that makes sense.
Yeah,
And maybe
Will, I'm happy to take this one.
that's how we really focus that. So we're utilizing those resources the best we can, knowing this also, this is evolving and we're changing the dynamics of this group here next year.
Yeah, thanks, Alicia. That's a great point. So for the first part of your question regarding the previous 3% set-asides, yes, 3% of whatever's in the impacts bank account has always been taken out as part of that, and set aside for eval work. And those monies have gone to OHSU, PSU, School of Public Health, for the development of the REDCap database, and now the maintenance of that REDCap database and their data quality work and their technical assistance provided to grantees on the data entry that's required, as well as some of those monies have gone to the OHSU Center for Health Systems Effectiveness on that statewide evaluation work, for which we're really excited. I know that there's going to be another report coming out in the next year for that work. But that being said, I think that we're in a good spot for this data eval work, and OHSU, PSU School of Public Health have kindly offered to keep the database open in this weird interim of no contract, no funding for that first quarter of 2026, January through March, so that existing programs have the opportunity to continue reporting data should they choose to do so. And with that, they'll also have an ability to look back, is my understanding, at the past data entries that they've made to have that full picture. And then if they are granted additional funding, they will be able to see all that data, back to July 1st of 2025, certainly, as that's the beginning of this project period. But we can inquire with OHSU if it would be possible for them to have that, backwards look available for all their data so that local jurisdictions have all of their data accessible.
Yeah, I think with that significant of an investment over if we're on our third period, right, Casey? So we're close to $900,000 in investing and trying to collect this really important information. And so I would hope that will be available and that we can really use that in a meaningful way moving forward.
Yeah, most definitely. And I think, Will and OHSU worked together on many elements of this GPOP too. So thinking about this being this operational document that will also be of use to OHSU when they're helping us analyze the data that's being reported for this biennium. So I think that's exciting too for the future. But yes, that money has gone to good use, and definitely the creation of this database and now the continued maintenance and operation of that database.
Thank you, Co-Chair Beck. GRC members, I just want to make sure, is there any additional discussion of these past priorities before we proceed? Okay, so we have reviewed the application and its contents, as well as how this GRC might rate or rank these applications over time. Very grateful for the robust discussion of priorities. And so just a few words about next steps for staff and this GRC. The solicitation will be released on Wednesday, December 17th, and will be open until January 23rd, 2026. Application review will occur late in January and early in February, and this GRC will reconvene sometime during the week of February 16th to review applications and make award decisions. So we have reached the end of our content for this meeting, and in our remaining time, I'm glad to answer any questions about any items that we've covered today, discuss more about next steps, and I would also invite the co-chairs to provide any remaining comments they may have at this time.
Just a thank you to GRC members for all of the discussion and input. And I think that, we are moving forward in the right direction with some of the changes we made to the priorities, even though it was just striking out that letter D, but adding in some application questions specific to success and how they're getting at that in both a forward thinking and reflective state. And I also appreciate, Janie, that SIM link. We'll make sure to get that into the application where it belongs so that folks can use that as additional reference. I know that Gobi has all of those laid out very clearly on their website, so I think that would be a good resource. Thank you. Sam, are there any comments that you wanted to make? Right, hearing none. Will, I'll hand it back over to you.
Thank you very much. All right, I just want to say thank you again for your attendance and attention to the items that we brought to the GRC this morning. If you have any questions about an item that we've covered today and you'd like to reach out, my contact information is here. I'd be glad to hear from you and to help. Otherwise, I will say thank you very much for your attendance this morning. I hope everyone has a wonderful holiday season and is able to stay warm because it's getting colder here. Thank you.
Thank you, everyone. You're all grand.
Thank you all.